we're going to be jumping into part 2 of our webinar series, focusing on client reminders and small media to increase cancer screening, specifically breast, cervical, and colorectal. So I'm Allie Bain with the American Cancer Society, and I'm going to be kind of leading the discussion today. So today for our introductions, we would love for you to share your name, your organization, and where do you typically find the educational materials that you use with your patients or clients? So do you make them in-house? Is there a specific organization that you work with to get materials? So during our conversation today, we're going to be exploring some different resources. So I'd love to hear kind of where you're currently getting educational materials from and what you're using. Everybody's shy on a Monday. Some folks are saying that they use their marketing department, creating them in-house, CDC materials, American Cancer Society. All right, great. So as I mentioned, this is part 2 of our series. So today we're really going to be exploring available resources and messaging that you can use while you're implementing client reminders and small media interventions. And then we'll dive into targeted messages based on specific population needs and motivations. And then at the end, we'll talk a little bit about opportunities for ongoing support and learning. So as a little bit of a level set, much like we did in the first webinar, we're going to talk a little bit about health equity. So this is the American Cancer Society's definition of health equity. And then I just pulled out what I kind of see as the most important part when we're talking about these 2 interventions. So providing tools and resources based on the needs that allow everyone the opportunity to be as healthy as possible. So really focusing on tailoring whatever we're doing to make sure we're meeting the needs of the population that we're working with. And then again, it just says a little bit of a level set. We're going to be focusing on client reminders and small media today, which are recommended interventions to increase cancer screening for breast, cervical, and colorectal by the community guide. And as you can see from this chart, there are a lot of recommended interventions. And then the ones with the yellow diamond that have insufficient evidence, that doesn't mean that they don't work. It just means that we need some additional research to show that they truly work and under what circumstances. And then one other thing to note is the way to make the most impact when increasing cancer screening is to use multi-component interventions. So that means implementing multiple interventions at one time, focusing on both clients and providers in order to increase cancer screenings. All right, so we're gonna hop right in. So you can feel free to put your questions in the chat. We'll probably get to those at the end, but Becky, if there's any that you want me to address immediately, please feel free to interrupt. So when we're talking about messaging, the American Cancer Society has created 3 communication guidebooks for colorectal cancer. And I just have to say that the work with the National Colorectal Cancer Roundtable and ACS, these are truly great guides. So a lot of research went into these, including focus groups, surveys, testing the messages, doing individual interviews. So these really provide some great information when we're trying to figure out how to reach people. So the first guidebook that I'm going to talk about is the 2019 Colorectal Screening Messaging Guidebook. And this is kind of an outline of everything included in the guidebook. So It's very comprehensive. It's pretty long. I know it can be a little bit intimidating when I share it with partners and they're like, oh, this is 55 pages. But it really is packed full of great information. So these are kind of the main topics that are covered. So understanding the unscreened. So what are perceptions, attitudes, barriers, where do people get their health information, and then underlying emotional drivers. So what really are those motivating factors? Groups of interest that we'll talk a little bit more about on the next slide. So how can we kind of categorize folks in order to develop messages that can reach them? Barriers to screening. So how do we address barriers and procrastination? Motivating the unscreened. So again, what motivates people to get screened within 6 months of receiving a message? What can make screening easier? What creates screening anxiety? So we know, especially with colonoscopy, there's a lot of anxiety around the test. So how can we alleviate some of that? And then continuing to keep people motivated, knowing that screening is not a one-time thing, that you have to continue to screen throughout your life. What are preferred channels for receiving messages? So who are trusted sources? Healthcare providers, health organizations, family and friends. So we talked a little bit on the last webinar about the importance of family and social circles, knowing that those folks can have great influence on influencing their friends and family, and knowing that there are multiple screening options. The elements of effective messages. So, what are some themes? What appeals to people? And then the most preferred messages. So I'll hop into some examples of kind of some preferred messages for some specific groups. And so then at the bottom, which I think is really cool from a health equity standpoint in this guide, is we break down messages for priority populations. So that includes Asian Americans, African Americans, Hispanic and Latinx populations, rural folks, busy bees, the fearful delayers, the invincibles, financially challenged, the marketplace insured, the early underscreened. So we know that individuals that are younger are less likely to get screened. So that includes the 45 to 49 population, which has been a part of ACS's guidelines for a while. And as we know, it's just recently been included in the USPSTF guidelines. And then the young 50 to 54, which we know are typically not screened at as high rates either. So breaking down these groups a little bit more, I think that this kind of gives an opportunity to see why we might need more focused messages and more specific messages for prioritized populations rather than just a standard message that we send to everyone. So we have the fearful delayers. So these are the people that might be scared of the colonoscopy prep or have fears about the procedure, or that who might be procrastinating for any of these reasons, just because there's a little bit of fear involved in knowing that that a colonoscopy is an invasive procedure. The invincibles, I probably include myself in this category. Not that I'm quite ready for colorectal cancer screening, but the people that don't think that they're going to get colorectal cancer, they don't have family history, they don't have symptoms, they're healthy. It doesn't really seem to be that important. They're not worried about it. The busy bees, so people that are too busy taking care of their family, they don't have enough time off of work, or they might have other health issues. They're worried about other things. And then the financially challenged. So of course, all of us on the call are very familiar with this. So these are the people that are uninsured or who have a household income below $40,000. And then in the bottom box, we can see some notable barrier differences among some different categories, which I also think is really interesting. So in whites, we see that the biggest barrier is the prep for a colonoscopy. Asians cite that doctors don't recommend it, or they don't think that they're old enough to need colorectal cancer screening. Marketplace insured are worried about out-of-pocket costs. Again, that young 50, the folks that are newly eligible for screening are just procrastinating. Rural dwellers, I think dwellers is a fun word to include there, are more likely to cite that they don't want to know if they have cancer. So again, back to that fear. And then women who are more likely to also cite the PrEP or not having family history. So knowing that these are kind of the barriers, we have to develop messaging that can address this and help to motivate folks. So here's an example. And within the guide, this guide could be its whole own hour presentation. So these are just some examples that I pulled out of here, but there are similar messaging like this with kind of the top 3 messages, the percentage of increase for screening within 6 months after receiving the message for all of these populations. So this is why this is such a long guidebook. So I'm not going to read these to you. I just kind of have read enough right off this slide. But as you can see, all of these messages address the barriers that we talked about with folks that live in rural areas. So, you know, we know that access is an issue. So, you know, there is a test you can take at home. If we're thinking about white folks that live in rural areas, knowing that there's some fear of colonoscopy. And so we can see that these messages really resonate with rural folks, and the little quotes under each of the messages come from people that were involved with the research when they were testing the messages as to why the message kind of resonated with them. And you can see that, you know, these caused the screening rates to go up as much as 6%. So a significant increase just from doing some messages. And then this is the same thing for the financially challenged. So again, knowing that colonoscopy isn't the only screening option, and that there are affordable test options, which I think is really important for people that might be financially challenged to know. And that increased the screening rate by 7%. So again, significant increase there. All right, and the other 2 guides that I shared, one is recommended messaging to reach Asian Americans, which this is what's called a companion guide. So it's a lot shorter than that initial communications guidebook. But this is very cool. I don't think I have seen this comprehensive of communication guidebook for the Asian population in any other place. So similarly, just talking about why it's important to reach out to Asian Americans, what are their barriers, what are perceptions, what do they see as a screening options, and then kind of in that 5th column with tools to reach priority populations, it includes custom materials for Asian American populations, social media, radio and TV PSAs, brochures, and materials in Asian languages. So just kind of a great wealth of information. And then this is just an example. So these are the recommended messages for Asian Americans with, you know, making sure that Asian Americans realize that they are at risk. That message of make sure that you're healthy for your family and grandchildren. Being healthy does not replace the need for screening. So you can see kind of how those messages also can reflect some of those initial barriers and information that we had just talked about. And then you can see on the right side that there are the 4 other languages besides Chinese that are included in the guide. So for those of you that do work with Asian populations or Asian American populations, this is a great tool. And everything is translated into those other languages too. And then the other companion guide is for Hispanic and Latinx folks in increasing colorectal cancer screening. So similarly, talking about what kind of are the perceptions in the Hispanic and Latinx community around health, around cancer screening, what barriers look like, top-rated messages, and then similarly to the Asian American companion guide, there's a deep dive with graphics, sample tweets in Spanish. I know that that can be a barrier sometimes, that we don't have messages translated, and so this is a great tool that you can just pull directly from. And then it also provides some information about where you can create custom materials in Spanish. So this is just an example of the top rated messages for the Hispanic and Latinx communities. And they are both in English and Spanish to help address some of the unique barriers. And again, you'll see in C, kind of that emphasis on family. And D, that colon cancer is the second leading cancer killer in the US among Hispanics. And so I think that, or I hope that you can kind of see how the development of these messages really does help to address some of those barriers and concerns and motivations for folks. And then one other thing I'll just mention before we dive into our next section here is thinking about how we can make sure that we use these messages consistently in our clinics. So whether you're talking to someone, whether you're making a flyer, whether you're sending an email, whether you're sending a text message, how can we make sure that we're consistent in the messages that we're using? And also when we're talking to our patients. So, you know, knowing what people's motivations might be or what their barriers might be, or exploring those barriers, how we can address them with some of these tested messages that we know work. All right, now we're going to dive into a little bit of some small media and client reminder resources. Like I mentioned, this is pretty ACS heavy, so I would love to share in the chat if you have some other resources that you love. And then I will share a couple kind of other cool resources and sites throughout as well. So just as a reminder, small media includes videos and printed materials such as letters, brochures, and newsletters. They can inform and motivate people to be screened for cancer, and they can be tailored to individuals or target audiences. So this will be heavily focused on printed materials. And then client reminders are written, telephone messages, emails, or automated messages advising people they're due for screening. So again, a reminder that these are for folks that have not completed screening, not just an appointment reminder that they have a screening coming up. And thinking about some of the messaging that I've already shared, I think you can see kind of how that will fit into develop some of these client reminder letters or emails or phone messages as well. All right, so some of these are going to be kind of small, but we will have everything available. Once Christy gets back, we'll put everything in a Google Drive and send out an email to everyone, and you guys can have access to all of these PDFs. So this is probably our most used piece of small media at ACS from my perspective. So this includes all of the recommended cancer screenings and the cancer screening guidelines. So this is kind of a one-stop shop for folks that are due for cancer screening, and they can reference the sheet based on their age to see what screenings that they are eligible for. And then on the right, you can see all of the additional languages that this is available in. So ACS is getting much, much better at having materials available in multiple languages. So I think right now we're up to 13 including English. And then we do have a poster size version of this, which can be nice for like exam rooms and things like that in English and Spanish. Next, we also have ACS branded reminder postcards that can be co-branded. And as you can see, these messages that are included on the cards are in both English and Spanish. So it's a bilingual card, which makes it a lot easier than having to manage multiple cards in English and multiple cards in Spanish. These can be co-branded, but we do require a licensing agreement. So if your clinic is interested in doing some postcards that include ACS branded messages, we can certainly do that, but you'll just have to email me because we'll have to just have you sign that licensing agreement. And then these are available in breast, cervical, and colorectal. And then whenever we're thinking about what is how do people want to receive information? We know that infographics are very popular. So we do have infographics that do talk about the screening options, the screening guidelines for colorectal cancer, which can make it a lot easier than just reading a document and much less overwhelming to patients that are trying to understand if they are due for screening. And then we also have these flyers. So these are a little more traditional with how the message is conveyed with the photo and then the text at the bottom, talking about that colorectal cancer is one of the leading causes of cancer death, and that you need to find it early. It shouldn't be expensive, or it doesn't have to be expensive. So again, addressing kind of the barriers and motivations for folks. And then this one is also available in those other 12 languages as well. And then this is only available in English and Spanish, but I think from a colorectal cancer screening standpoint, this is one of the coolest, the most comprehensive pieces of small media that we have. So this is 3 pages that kind of talks about everything. So what is colorectal cancer? Why should I get screened? What are the test options? So you can see in the middle there, there's little boxes that talk about each of the screening tests. And then the 3rd page actually includes a little bit of a decision aid. So it allows patients to fill out the middle section there with the blue dots to see like what test might be right for them. So, do you want to collect a stool sample? Do you want to be screened every year? Are you worried about having an invasive procedure? And so you can help to determine what test might be right for a patient by them completing this little survey. So one thing I've heard of clinics doing is just having one copy of this and laminating it and then giving it to folks and giving them like a dry erase or an erasable marker to fill out the decision aid section, and then sharing that with the nurse or the doctor whenever they're roomed after waiting in the waiting room. And then at the bottom, it also talks about some myths about colorectal cancer screening, which, as we all know, there are quite a few. So in addition to the decision aid, which has the small comparison of the screening tests, we also have full page descriptions of all of the screening tests. So it does include all of the recommended screening tests. I just pulled these 3 because I feel like these are the 3 most common that we use. So FIT, multi-targeted stool DNA test, or what we commonly think of as Cologuard, and colonoscopy. So these provide all the information that a patient might need as far as answering their questions. So how do you do the test? Do I have to take off work? How often do I have to do it? How much does it cost? And then what happens if the test is positive, which as we know is important with the FIT test and the multi-target stool DNA test, knowing that a colonoscopy will have to be done if the test is positive. So this is also a great one to laminate, put on a little ring and hand out to patients when they're in the waiting room in preparation for talking about colorectal cancer screenings. Now on to breast cancer. So similarly to colorectal cancer, we do have the same sort of infographic with the breast cancer screening guidelines. So these are the ACS breast cancer screening guidelines, which I recognize are a little bit different than USPSTF, but still great information. And then we also have Finding Breast Cancer Early Can Help Save Your Life flyer, and what folks can do, or what people with breast can do in order to help to reduce their risk. This is another really popular one. So 7 things to know about getting a mammogram. So much like a colonoscopy, mammograms can create a lot of fear for folks. And so this just helps to alleviate some of those fears and concerns by addressing 7 different things that people should know. And again, this has the comprehensive list of languages that this is available into. And then one campaign I pulled from the CDC because I think the imaging is really nice. So this is the Bring Your Brave campaign that they started a couple of years ago now, I think. And they have this flyer that really touches on everything related to breast cancer. So learning your family history, understanding counseling and genetic testing, making healthy lifestyle choices, and getting screened. So if this sort of imaging you feel like would be appealing to your patients or clients, this is a great option. And then for cervical, admittedly ACS has less materials available related to cervical cancer, but this is one flyer that I think does a good job of kind of comprehensively talking about the HPV test and the pap test, and just kind of what screening options look like for cervical cancer. And again, that this is available in multiple languages as well. So now to kind of a fun one. So this is called MIO, which stands for Make It Your Own. And this is a completely customizable website that you can develop client reminders, small media, flyers, posters, kind of whatever you want, digital, print, and it allows you to really customize your own images, your own messages, your own designs, whatever you feel like you need in order to reach your target audience. And so these are just 3 examples that I pulled directly off of me. I didn't make these. And so you can see that all of them include kind of an image, some messaging, the contact information for whoever the organization is that developed it. And so a couple of these kind of look like a small media. One of them definitely looks like more of a client reminder. And so, like I said, these are fully customizable. You can put whatever images on here you want, any sort of messaging that you want. Of course, you want to include a call to action, like we talked about in the first webinar. So, talk to your doctor, call us, email us, whatever you want folks to do in order to get screened. And I think we're going to have plenty of time here today. So if you want me to do a little bit of sort of a demo on this, I'm happy to do that. All right, and then so this is one of my favorite tools, resources. So this used to be known as RTIPS, and they recently changed the name to Evidence-Based Cancer Control Programs because CDC and NCI needed a new acronym. So it's EBCCP now. But this is a really cool tool, and I can also do a little bit of a demo on this one if you all are interested in that too. So the way this works is you go onto the website and you select the intervention that you're looking for, the program that you're looking for. So these are all of the options. Of course, for our purposes today, We're going to focus on cancer screening, but you click one of these, and then you have an opportunity to sort by your target audience, by your demographic, by age, by geographic location, and it will show you different programs that have been developed and all of the materials and resources, including an implementation guide that the original program used to successfully implement the intervention. So this is one example. So this is a program to increase breast cancer screening. And this is all of the tools that the program used at Community Internal Medicine, which I think is a part of Mayo actually, in order to increase their screening. So it shares their workflow that you can see kind of in the background here. It shares their phone script that you can see kind of on the right here. It shares their letter that they used, which is actually longer than this, but I just screenshotted part of it for these purposes. And then also the brochure that they share. So you can see, going back to thinking about the community guides recommendation of using a multi-component intervention, that they're doing everything. So they're doing reminder calls, they have small media, they have workflows established to make sure that their providers are asking about cancer screening. And all of these are available for download. So that's why I think that this website is super cool, because there's no need to recreate the wheel. And we can also see the importance of having consistent messaging. So you'll see in the phone script and in the letter that some similar messaging is used. And then hoping that also all of the clinic staff have also been trained in the consistent messaging for people that need to be screened for breast cancer. So one other thing that it's not necessarily related to small media or client reminders, although it could be, but another great resource, and we know that frequently everyone is always asking about where to get ready-made social media messages. And so this is from the George Washington Cancer Center. And all of these links are live. So whenever you receive the slides, you can click on any of these, and it has each awareness month's ready-made Twitter and Facebook messages. So, excuse me, this is not the complete list of all of the awareness months, but these are the ones that I figured that this group would care about most. And then they do update these annually, you know, if screening guidelines change, or just kind of to refresh them a little bit. But these are all great places to find social media messages, so you don't have to kind of recreate them on your own. All right, so that is kind of all that I have from a presentation standpoint, but I'm very interested to hear kind of what your reactions to some of this are, what you guys, if you already knew these resources exist, if you're excited to use them, if you have any questions or thoughts. So we have about 25 minutes left that we can just chat a little bit. And like I said, if anybody's interested in seeing a MEO or an EBCCP demo, I'm happy to do that too.
Allie, we did have a question come in to the chat earlier.
Okay.
Have you found that certain age groups prefer different avenues of reminders, such as the older population prefer the postcards or younger text, or the younger text?
Yeah, I mean, I think that generally we can assume that, but I think also we can't doubt that older folks also are tech savvy. I think often we make assumptions about how older folks would prefer to receive their reminders or their information. But there certainly are some tech savvy older folks out there too. So I think just you need to understand the population that you're working with You know, if you're talking about an older population in a rural area that might not have great connectivity, then postcards might be a great option. But you know, if you're talking about older folks that live in an urban area that order their groceries on Instacart, like sending them a text message is probably fine. So I think generally you're on the right track, Terry, but I think it's also safe to not make assumptions about the perceptions and preferences of older folks. But I would also say that definitely younger populations are tech savvy, and you know, we're getting to the point where people that are eligible for, especially for cervical cancer screening, have never not known life without the internet. So engaging, you know, millennials and Gen Zers on through electronic methods seems very appropriate.
Feel free to put questions in the chat or just come off of mute. We're small.
Yeah, please feel free to come off mute. I'd love to hear from some folks. Oh, it's a sleepy Monday. Well, while you're putting your questions or chats in, or your questions in the chat, one other thing that I can share, we are currently exploring with CDPHE the possibility of doing a little bit of kind of a learning collaborative where we would dive in a little bit deeper into actually implementing these two interventions, where we'd work on setting goals and developing workflows and evaluations, and we could work on that together collectively. So that's something that we're exploring. So if anybody is interested in that, or you think that your organization might be interested in that, we'd love to hear what that interest would look like, to see if that's something that we could continue into the new fiscal year starting in July. All right, Terry says she wants to see the demos. Let's see how tech savvy I can be here. All right, can you see that?
No, we still see the slide. I think you need to maybe unshare and then reshare.
Okay, is that better, Becky?
Yes, now we can see them.
Okay, so this is the website, and like I said, this is recently revamped, so it's very cool. So the way you navigate it is you click on this search now, and then what is this doing? Of course, my live demo is not going like it regularly does whenever here we go. So here are the program areas that I mentioned on the in the presentation. So breast, cervical, colorectal. So since I kind of did a breast example in the presentation, let's do a colorectal example. But these are all navigated the same way. So on the left-hand side here, you can see population focus, delivery location, community type, age. And so all of these are, you can filter by all of them. So if you want to focus on clinicians, individuals with familial colorectal cancer, medically underserved, un or underscreened, delivery locations, so home, religious establishment, workplaces, community type, age, sex, race, ethnicity, and then for the materials, like I mentioned, pretty much all of these have materials available. So they're available from third party only, available on the website, or partially available on the website. So let's just pop some things in here and see what we get. So let's click unscreened. Delivery location is the clinic. And we'll click mail. Let's see what we get. All right, so these are the 4. I had a little moment counting there. So these are the 4 interventions that are shared that meet our search criteria. So this one, I don't know what these are, so we're gonna find this out together. So if we click on this, we see that this is a colorectal screening intervention program. And so this is to increase colorectal cancer screening among African-American adults. And this information is delivered by a health educator who does small group sessions, which could be one-on-one education or group education as the intervention. It could also include small media. And so as you can see, it really lays out all of the different components of the program. And then the cool part, the program materials, the implementation guide, and the program developer. So you have access to all of these kind of right at the edge of your fingertips. And so if you click on the program materials, these are all available to download. So knowing that this is an education session, here's the facilitator's manual, here's the implementation manual, and kind of everything that you might need in order to implement the intervention. So very cool. Is that helpful, Terry? Does anybody have any questions about that or want me to? Oh, there's also a recipe book. Yeah, slide presentation. So everything is just plug and play. You can just download them all right to your computer. All right. Now let's do. Yeah, if you go to just make it your own, it goes to a consignment shop. So it's myoworks.org. I learned that whenever I was trying to figure out what the website was. So, so this one also very cool. So you do need an account in order to access this, but it's, I mean, it's a simple account. It's not a big deal. And so this one, again, you choose breast, cervical, colorectal, Meals on Wheels, HPV vaccination, kind of whatever intervention you're looking for. So let's choose cervical for this one. And then this gives you kind of all of your options to begin with. Do you want a poster? Do you want a flyer? Do you want an insert? Do you want a question card, a postcard, a banner? So let's choose, how about we choose a poster? So this is kind of your starting point, and then you click on Make It. And then it gives you all of these text field options, your call to action, your contact information, your logo. You can include images, kind of anything that you might want in your small media or your client reminder. So it's kind of similar to Canva. If folks have used Canva before, it's just very specific to public health messaging. So again, as you go through, you can add kind of whatever you want. And then if I just go to browse, I think we can see a whole collection of them. Yeah, so here's an example that's kind of filled out with everything. So yeah, those are just two examples of kind of fun, let's not start from scratch tools that are available. So I hope that that's helpful to everyone. All right. Any other thoughts or questions? Was this helpful? Did you guys learn something? Is there a tool that you're excited to use? Right, group. Becky, do you have any questions or thoughts?
We don't, but we will make sure to get everything sent out as soon as we can. Christy, who normally does that, is out dealing with a family medical emergency, so we will try to act as quickly as possible.
Yes, so Emily, I think we're going to put everything in like a Google Drive or SharePoint site to send out so that you can have access to all of the small media flyers and one pagers and all the toolkits too. So yeah. And if you're so excited that you want stuff right now, just let me know and I can send them to you before we get everything set up and sent out. Becky, you're on mute.
Thank you. I just muted myself instead of unmuted. It's a quiet group today, but we would love any feedback on if these types of webinars or sessions are helpful. And if you'd like more of these, we want to make sure that these are useful for you all. So open to any kind of feedback you have. I don't think I have a link that we probably normally use for evaluations.
We haven't done it. We didn't do an evaluation for the first one. We just kind of collected participants' feedback as we went. So
feel free to come off mute. We'd love to hear from you if you're willing.
Allie, I have a question. I don't know if it's a question. Just want your feedback. I know a lot of people that we've talked to are using Canva, and I don't know anything about Canva, but I'm wondering if there's like, you know, sort of a way to marry Canva with like some of these tested messages and things like that. Or I don't know if you have more experience in the Canva world than I do.
Yeah, definitely. So Canva is very similar to the Mio sort of application that I just showed, where you can kind of plug and play with different designs and templates and upload your own images and things like that. So I would say, yes, there's definitely an opportunity there to take some of the tested messages from some of those communication books and put them right into whatever you're designing on Canva based on the target audience and population that you're trying to reach. So yeah, that's a great idea. All right, Becky, well, I think we got a quiet crew, so we can go ahead and end early. I'll put my contact information in the chat. If anybody has any questions or wants to talk any further about anything, or like I said, is super excited to use any of those resources and wants them today, feel free to reach out, and I'm happy to send those over before we get everything kind of compiled in one place to send out. So thank you so much, everyone. And look for an email with the recording, the slides, and all of those resources coming, hopefully in the next week or so. So that's kind of our timeline. But we'll definitely get them to you, so just hold tight. So thank you so much, and we will talk soon.
Thanks, everybody.